Hi everyone, good evening for those in the UK. Hello to those in the States or anywhere else in the world. I'm really looking forward to speaking to the legendary Dr. Smikle from Laurel Fertility Care today. And we're going to be talking about a massively important topic as it is Mental Health Awareness Month this month in May. And we're going to be talking about what to do between cycles, after baby loss, all sorts of different scenarios that people are navigating in the fertility world. And he will be giving tips on mental well-being during cycles. So let me welcome him in now. He's joining. He's here. This will be great. I love lives with Dr. Smikle. So have your questions ready and he will be very happy to answer. Hi to those who are joining. Just getting him in now. Bear with me. Hello. Are you there? We can see a wall at the moment. Hello. Hi, Dr. Smikle. How are you?
Hi, how are you doing? I apologize about not getting in here on time. So
No. We're actually early. It's great to see you.
Okay. Can you hear me?
Yeah. It's great to see you.
Perfect. Well, thank you again for allowing me the opportunity to join, and hopefully we can provide some information for everyone to kind of go through the process.
Definitely. Well, I just made people aware, if they're not already, that May is Mental Health Awareness Month. So we've decided today to speak about mental health during treatment, but also between cycles and, if there has been loss, for example. So the first thing I wanted to ask you is, and I know that this is a bit of a general question, it depends on the person, etc., but how long do you recommend patients wait between a failed cycle and starting a new cycle?
Well, that is a really challenging question, and I know that everyone actually has a different way to kind of look at it. My recommendation has a lot to do with how quickly someone wants to kind of, for lack of a better term, go directly back onto that wagon and start again. A lot of it depends if you're doing a fresh cycle and you're going through and planning a second cycle. A lot of it has to do how well your ovaries are actually functioning. So if your ovaries are actually, quiet, or let's say you don't make a lot of eggs, or let's say you're for some special patients where they're cancer patients, you might want to go pretty quickly to try to do the next cycle. So in some respects, you may be just waiting, 10 or 12 days between the retrieval and the next group of stimulation medicines. So it can be as short as that.
Okay.
For others, it's really hard to sometimes go directly from one cycle to the other, and sometimes people will need a break. And oftentimes we'll say the best thing to do is to do it within a relatively near term, so within 1 and 3 months after the retrieval. And especially if you produce lots and lots and lots of eggs, then you'll end up having to wait that time frame to kind of get everything back to normal, if you will. But, I'd say that 1 to 3 month time frame is typically the recommendation in terms of someone's going directly into it. There are some women who have tons of eggs, so therefore between 6 months and a year may not make that much of a difference.
Mm-hmm.
However, a lot of patients are probably not going to wait that long because psychologically it's hard to kind of just think about waiting that long.
Yeah. You must have seen a mixture of patients, some who want to just get back on the horse and others who don't after a failed cycle. And obviously we're sort of focusing on the mental well-being side of things. Do you recommend that if people are really struggling emotionally after a cycle, that they perhaps wait a cycle, or that they just go back into it and try again?
I think the biggest way to answer that is just that if there's any mental anguish or mental challenges going into the cycle, I'd say the best thing you need to do is to learn how to basically support yourself.
Mm-hmm.
So that would mean taking the time you need, talking to someone, having someone kind of help you through that process, and not, regardless of what the outcome may be, not jumping directly into the cycle. This process is a very exhausting, both physically financially and also emotionally exhausting procedure, and you need a team of people around you who are going to support you through the process. Without that team, you may end up actually being successful in some respects, but really having a difficult time afterwards in terms of navigating everything else.
Mm-hmm.
So our goal is always to provide you the measures to kind of make sure you're going to be have that support you need,
Mm-hmm.
and take care of yourself. That is the most important part of everything.
And
Because not taking care of yourself is going to be the hard thing.
yeah, absolutely. And I mean, for me personally, my mentality was I just wanted to get straight back out there and try again. My husband wanted to wait a little bit. So do you see couples or even people doing it individually kind of having different views on what they want to do in terms of how long they might wait?
I'm sorry, say that one more time. I missed the last part.
Well, depending on whether someone's coming to see you as a couple or individually, if they're coming as a couple, do you sometimes see different views? So one of the couple is really eager to try again, and the other one wants to wait and just have a bit of time out.
Mm-hmm. Well, I think the reality is just that you're right. We always think about things as basically just treating you, the patient, but your partner is an integral part of that process as well. So that person's going to need the same sort of support and everything else to go through that process. And if they're not ready, you do need to make sure that both of you are actually on the same page.
Mm-hmm.
From a physical standpoint, meaning the person going through the retrieval may be the one that's ready sooner, and especially if there's a loss involved. Let's say there's a pregnancy and there's a loss, that may take a longer period of time to overcome. And oftentimes we sort of remove or ignore your partner's role in terms of providing that support and the things that they're going through in terms of the process as well. And it's really critical to make sure that both of you are going to go through it, because the goal is for you for both parent together. The goal is for both of you to basically survive it, so therefore your relationship can actually manage and be supported through the process.
Mm.
And that's something that sometimes it just gets ignored.
Mm-hmm. And for anyone joining, Dr. Smikle and the team have written a fabulous article for us all about this theme. So if you want to know more about mental health, well-being during cycles, before cycles, after loss, in between, whatever stage you're at, please head to our website. The link will be in the bio, and you can read more. I have another question for you, if that's okay.
Okay.
Miscarriage, and we sadly have so many people in the community struggling with this, and of course you'll see so many patients who have...
I'm going to turn up my volume here a bit because I'm having a challenge hearing some of those questions, so I apologize about the...
Can you hear me okay now?
100% hear you now, much better.
Okay, good. So baby loss, sadly so many people in the community suffer from it, and you'll see lots of patients who do. You've touched on this before, but in terms of waiting emotionally, but also physically, what would you normally say to patients who have experienced baby loss before trying to conceive again?
That one's a bit more challenging from the standpoint. It depends on how far along they were when that loss occurred. So let's say that you had a transfer and that transfer was not successful. That's still a loss, and therefore, you have to think about when to start again. That start may be as soon as with the next menstrual cycle, so therefore there's not really a delay. But let's presume that there's a pregnancy of any kind. Then you may end up having to wait a bit longer in order to start again. Mm-hmm. And that means you may end up having to wait until, it depends on how far along you are. So let's presume that you go through 6 or 8 weeks before you end up having that loss. Then you may end up having to wait 1 or more cycles in order to basically start again. The further along you are in terms of that loss, the longer you'll have to wait, because your uterus has to return to a normal size, and your body has to basically be able to kind of get, recalibrated, if you will, in terms of starting again. The other part to it as well is just that let's presume that there is some loss, and it's far enough in a pregnancy that you may end up having other issues develop inside the uterus. then you'll need to kind of address those issues before starting again. So that means, doing a saline sonogram, doing some assessment before jumping right back into everything.
Okay, yeah, that makes complete sense. Thank you. If anyone's got any questions for Dr. Smikle, please do ask. He's very happy to answer them. So thank you for that today. And where would you see scenarios where you would recommend your patients to take a break in between cycles?
That's one of the things we talk about often, because I think, again, as we're talking about this and talking about someone's mental ability to kind of walk through, for me, sometimes it does feel like you're providing more, mental services or social, or you're a social coach rather than simply being a physician, because you're talking about that person's well-being. And so, I'm asking all the time, how are you doing? And do you need to take a break? And so we'll ask directly. And if it seems like someone is really anxiously going through the process because they're simply they want to get to an end, and it's creating more and more of a problem in their relationship or in their own health and well-being, that's when we'll basically say, look, in my opinion, you need to basically take some break, because you're physically, even if you got pregnant, you would physically not be able to complete or do well with the pregnancy. And therefore, you're more prone to having more complications with the pregnancy. It's not to say that mental health or being psychologically depleted is in and of itself a problem that's going to arise with or inhibit the pregnancy. But you have to look at the fact that postpartum depression, and all the issues related to, basically depression with pregnancy itself may increase if someone's not in a state or capacity where they can function. They may not be able to function at work. They may not be able to function in their relationship. And all those are integral parts of basically managing that process as well. So it's important to have all those things in hand. And that's where really partnering with, a group of mental health support staff are going to be really critical and important.
Mm-hmm. Absolutely. And what do you guys do at Laurel Fertility Care to support people's mental health? Because I know you have a fantastic emotional support that comes with for everyone who's having treatment with you.
Well, I think one thing is, first, we have a really great team of, people going from the medical assistants to the nurses to all the people who are actually supporting the roles. So that's critical here. We're also networked with a really integral group of social workers and mental health counselors, grief counselors that we actually provide or at least refer patients to. It doesn't have to be in person. There's a whole host of resources now that are actually either online or by telehealth conferences that you can actually avail yourself to. So we really try to support patients in going through and making sure all those services are available, because it's critical to have them, patients feel supported going through.
Mm-hmm. Absolutely. Infertility Unfiltered is an amazing group that you have as well. Someone has asked, regarding having a break, this person has been trying for 2 years and they've sadly had 3 losses. What would be your thoughts on starting the process again?
In that situation, I'd say, that's really unfortunate that they've gone through those, but it's important to kind of figure out why. And that's one of the reasons why, rather than simply jumping on the course again to start another process, is stepping back and say, okay, we need to understand why there's been these losses or these attempts that are not successful. And just stepping back and gathering more information is going to build in a break in the process. It'll also provide patients information to say, well, this helps to explain why things aren't working. Mm-hmm. And all those pieces, all those things are going to be important, because it helps them to kind of basically feel that they have more control about the process. Absolutely. One of the things that contributes a lot to this is just this feeling of lack of control, and that's important. That's critical to manage throughout.
Absolutely. Do you find that it also depends on the scenario of the patient? So, for example, whether they're traveling overseas to see you, for example, that might determine how long they wait between cycles,
Oh,
their age, finances, all sorts of reasons, as well as part of, it being to do with mental health and needing a break, perhaps.
well, those things are all critical. And
Mm.
you're right, and especially given the challenges in terms of travel now, especially if you're thinking about international travel, those are going to be built-in circumstances that are going to introduce breaks that even they may be beyond the time frame you want to recommend, especially when age is a factor. Age is the most critical factor that we're looking at in terms of saying individuals who are trying to pursue getting pregnant using their own gametes. We may end up saying, look, we understand you actually are feeling really challenged and struggled right now, but taking a break, and especially taking a long break, may end up having much more dire consequences than pushing ahead. And we might say, well, we might want to build in resources to kind of help to support you as you go through the process, but your break should be shorter because we want you to be successful overall. That's the entire purpose of the process.
Mm-hmm. And that's really what someone wants from, an expert and a fertility specialist, isn't it? To be the person that says, right, from an outsider's point of view, this is what I suggest that you do.
Yeah, and that's the part. And sometimes taking a break sometimes means look, you've been going at this for a very long period of time, and this isn't realistic, and that means it's a permanent break from a decision in terms of maybe using your own gametes, and that's a much harder one because that's one that may require a lot more technical skill and a lot more support from resources, because that's basically telling someone that well, look, you've exhausted all your options, and in your in my medical opinion, this is the only other option you have.
Mm.
And that break to basically grieve that loss, mourn the ability not to use your own, maybe a long one.
Mm-hmm.
And as long as there's a time frame that they can come back to it and succeed successfully in terms of basically then using, say, donor eggs or donor as an example, that allows them the time to truly grieve.
Mm-hmm.
And that's an important part of the process as well.
Absolutely. The reason that I have children with a tiny age gap is because we went back and did another fresh cycle of IVF when our first child was only 10 months old. And that was because I didn't want IVF hanging over our head for more time. And I knew I'd have to have another retrieval. Our IVF cycle with her didn't work first time. It's that uncertain thing of not knowing how long it's going to take. So we did jump into it really quickly, and that's why we ended up having children so close together. But I presume you see that a lot where people, may have stopped breastfeeding early or things like that to want to try for a sibling, perhaps, just not knowing how long it's going to take.
That's true. And I think, one of the things that we're fortunate in terms of changes in technology, with the advent of genetic testing, what that's allowed us to do is to allow individuals a lot more psychological fortitude, if you will, to say, okay, I have these X number of embryos that are frozen that we know are genetically normal, and that gives me a little bit more of a buffer. It may mean when you're planning to do the cycle in the first place, just to make sure you have that mental buffer to say, rather than, let's say you want to build a family size of 3 or 4 children. It may mean before you're planning that first transfer to make sure you have enough of a buffer, if you will, in terms of frozen embryos that are genetically normal frozen, so therefore you don't have to feel like you're burdened by having to rush in terms of doing another fresh cycle. Because those are the things that you can kind of do to basically ease that urgency, that sense of urgency that you have.
Mm-hmm. The other thing that I was doing was, all sorts of dietary type things, running, not drinking. Everything was focused on the next cycle, and so I just didn't want to live like that indefinitely.
That's true. And I think just in terms of many things you've shared before in terms of your diagnosis with polycystic ovarian syndrome, all those things actually factor in, and not everyone's going to have the same things to kind of basically worry about. For you, diet was actually pretty critical. For others, it
Oh
may
no,
not
sorry.
be.
For me, it was my husband. It was the azoospermia.
Right.
But I was
Right. So,
with donor sperm. But I was just knowing that I was getting older. There was needs to be
right.
more eggs retrieved. I wanted to make my eggs as best quality as they could be due to financial burden, due to the stress of traveling for treatment, all of the above.
Yeah, and all those things are really true, and I apologize, and I realize that those are all critical things. Knowing what's there, knowing what you have to deal with, is going to be pretty critical. So you're right in terms of making those decisions. Sometimes does play a role in terms of jumping back on the wagon, if you will.
Mm-hmm.
So it's important.
And it's really hard because if it works and you have success, it's obviously wonderful. If it doesn't, then you kind of think, well, maybe we should have started earlier, or then you think maybe we could have waited a bit longer. So there's never really, it's really hard to judge what's right for you.
Well, the first thing that I tell patients each time is just that, I think the most critical thing that you find is just that you're your own worst advocate. You'll blame yourself more. You'll think of every single thing you did wrong. You'll think of every single way you could have improved or changed to basically have a different outcome. And I would say that the majority of times, most of those circumstances are well beyond your control, other than age and then time and finances. Those are the things that are going to be hard. So therefore, I think the biggest thing is to try to provide them the measures to say, you're not to blame. It's not your fault. It's not something that you've had any control over. Waiting 1 extra month, waiting 3 extra months may not have made any difference at all. And you need to be kind to yourself. This is actually a marathon, it's not a sprint.
Mm-hmm.
So jumping to that 100-yard line to do the next retrieval when you have a long life ahead of you is something that you have to realize is going to be a critical part of everything. And you have to find and build in all those things to kind of basically manage and maintain things for the marathon, for the long haul, not the short haul.
Top advice. Thank you so much. And for those who are joining or have just joined, please head to our link in bio to read more about mental health and to take a break, to not take a break between cycles after loss. Dr. Smikle and the team have written a fantastic article for us, so do check it out. You also have some very exciting news, don't you, regarding your new clinic?
Yes, so we're fortunate in terms of, basically after realizing support for a lot of people to open up a new clinic in our Oakland. We have a new office in Oakland, which is a nearby community. So it offers patients the ability to get seen locally. We have a team that's there. So therefore, they'll end up having to spend less time. I don't know about you, but traveling across these bridges and in traffic is one of the things that patients hate. So we're trying to basically bring more localized care to them. So that's one of the things that we enjoy having now.
Fantastic. And am I right in thinking during the month of May, you're giving away free AMH testing?
Definitely. That's one of the things that we offer at that site as well. So therefore, it's important to kind of have anyone who's interested to come by and that they'll give us a chance to kind of not only get information that's going to be important for you, but also get a chance to meet some of our staff and then say hi, see our new location.
Yeah. And your team are just so lovely and friendly, and that emotional support is key. And that's why I love the fact we're talking about mental health today. So if you'd like to find out more about this amazing new clinic location with which Laurel Fertility Care have just opened in the Oakland area, also on our website, please do read more. Do you have time for one more question, Dr. Smikle?
I definitely do.
Thank you. Do you advise extra or early scans if your patient is newly pregnant post-loss?
Yes, because I think one of the things that is really hard is just that I'm a firm believer in basically managing expectations. And I think although sometimes what you're doing is simply just managing your own anxiety, it's important to realize that, having an ultrasound, seeing the heartbeat that's there, seeing that growth and development, until you can confirm and assure someone that basically the chance of miscarriage is actually really small, is really critical. Mm-hmm. So therefore, sometimes we'll see patients just to make sure there's a sac there. Then they may end up having ultrasounds every week. one question comes up is that, can you have too many ultrasounds? There's a number of information or a lot of resources and a lot of research done by the American Institute of Ultrasound in Medicine, and they're shown that none of those things actually have any effect on long-term effects on the fetus. So having too many ultrasounds is something you have to be concerned about, especially those early ultrasounds.
That's really good to hear. Thank you for answering that. Well, thank you everyone for joining. Thank you, Dr. Smikle, for your time. It's been lovely speaking with you. And head to
thanks again.
To read more and contact the wonderful team.
All right, thank you so much. And again, thank you for all the stuff you do, because you do wonderful work in providing a lot of information to patients.
Thank you. Thank you. Thank you.
All right.
Speak
Take care now.
Bye-bye.
Right. Bye. Bye-bye.